Hello, my name is Melanie Hardy. Hopefully you can see the display there, ethical decisions and family conflict. And I apologize for the glare on the glasses. I can't quite get that adjusted. Anyway, um, moving on. So, yeah, hello. So we have an ethical dilemma presenting. There's a 45-year-old male patient who's intubated after a car accident. He's unconscious, but doesn't meet the criteria for brain death. The attending physician said the patient could survive, but would likely need life support for the rest of his life. The family is torn. Half are saying the patient wouldn't want to live this way. The other half are accusing those others of trying to kill the patient. There are also allegations of inheritance money upon the patient's death. This dilemma is causing conflict among the family members and is disruptive to medical and nursing staff. It is interfering with the general care of the patient. The ethical dilemma is how to resolve this conflict while respecting the patient and all members involved. So medical care issues involved. Providers are unsure how to care for the patient. They'll likely provide everything if the proponents for that are at the bedside. But if the family members are absent, providers will likely give the care according to the wishes of the ones present. The patient's probable life outlook should be fully explained to the spouse and family members, leaving no doubt that it will be challenging and costly. For example, the patient will require a tracheostomy, which will need cleaning and suctioning throughout every day. The ventilator will be supporting him, and that needs monitoring. There will be costs for that and all the supplies to feed him and keep him clean and comfortable. A home health nurse and oxygen supplies will also be needed. The patient will have a high risk of developing bed sores and pneumonia, either of which will lead to frequent hospitalizations due to infections. So there are those costs as well. And those aren't just financial, but emotional. And the family also needs to understand that although the patient isn't brain dead, the damage sustained means he'll likely never be alert and oriented. He could awaken or move spontaneously, but it won't necessarily be purposeful. And the family should be asked if that's a quality of life that they would care to endure themselves. Does the patient have a living will or advance directive? Did he designate a power of attorney to make healthcare decisions for him? If so, there's a legal obligation for all the parties to abide by it, as noted in McCall 2023. If he named his spouse, she can make those decisions. According to the American Medical Association, the ethics committee should be called in for consultation if there isn't a named surrogate, or in cases like this where decision making is difficult. Because the family cannot agree to a treatment plan, the committee would be appropriate. They serve as advisors, not decision makers, and aren't the last word in decisions for the patient care. But if a provider goes against the committee's advice, there must be reasoning and documentation for that decision. The committee must respect the rights and privacy of all participants, and stakeholders must have access to the committee's services when needed. They must also adhere to policies and procedures governing the committee and adhere to medical staff bylaws. It's also appropriate to seek guidance from national specialty societies and other professional organizations. Laws and regulations would be followed closely so as not to violate the wishes of those involved in the case, nor to veer from the appropriate care the patient deserves. The staff would also be reminded to do their job as they know to do and document accurately and appropriately. Possible ethical issues could arise if decisions can't be made. If the spouse has the power of attorney, she can legally make the healthcare decisions. and it's the contentions among other family members that are delaying care in possibly what are the patient's best interests. Ethics committee has policies and procedures to follow. The spokesperson to the family from this committee will need to ensure open communication with the family. This is essential for progress. Checking in with the committee routinely is also necessary to ensure progress. In Spitzger's et al. 2022, it showed there are 4 factors that complicate the management of family conflicts in cases like this. There are diagnostic and prognostic uncertainty, families not understanding what all that means, families' strong negative emotions, families' limited health literacy, and families' burden of responsibility. Physicians mainly use content-oriented strategies to resolve conflicts and when they're talking to families, but when they showed more empathy in this study, it helped shorten the conflicts and the families responded better. Tailoring their communication strategies to how best the family responds will help maintain ethical integrity. If family members become amenable, the conflict resolves sooner and appropriate care and treatment plans can go forward. When making decisions about this kind of case, it's essential to follow policies and procedures designed for it. For example, the hospital's policy regarding the ethics committee would specify things like who is on the committee, when and how they'll meet and communicate. There are other pertinent policies about human resources and social work, like those regarding advanced directive, foregoing life-sustaining treatment, patient rights and responsibilities, informed decision-making. Ensure the policies and procedures are being followed. As an administrator, it would be good to attend the ethics committee meetings and try to meet daily, if possible, with the social worker or pertinent team members or providers involved in the case. At the least, getting daily updates from a spokesperson is needed. You don't want anything to get out of control. There are many resources available to support this decision of the ethics committee. We can check with the American Medical Association website to check and see the physician's ethical and legal responsibilities in these cases. Becker's Hospital Review is a good source. It has a lot of information about what's happening in hospitals all over. They might have a similar case reported that can be reviewed. And there are studies available to review, and you can look and see what's been done and what the data shows to be the best method for helping to resolve cases like this.